So good afternoon, everybody. We're back here at the beautiful Merrick Park at Dr. Soler-Baillo's office. And we are filming our first Empower podcast event. And I have the first question for you, Dr. Soler. Thank you very much. Being a renowned plastic surgeon, board-certified plastic surgeon in our community for the past 25 years, what made you choose plastic surgery as your specialty?
Well, Maria, thank you very much. And it's a long story. I started out wanting to be a heart surgeon, and I studied in that direction. I achieved a master's in cardiovascular physiology, and I started getting very involved with cardiac surgery. And I realized that I didn't like the fact that many people died. And that's the honest truth. I wanted to help people, but it was very emotionally challenging to have people pass away. And because of that, I changed directions and ultimately found plastic surgery, which is a very diverse specialty. You could do many things in plastic surgery, one of them being cosmetic. And I gravitated towards the cosmetic part because I did some sculpting and some painting in my past. And I enjoy the challenge of taking something that's normal and making it more beautiful in a natural way.
Great. Well, thank you. Enid Lorenzo is going to ask you some important questions that were left unanswered after our EmpowerHer event.
Good seeing you again, Doctor.
Nice to see you.
So one of the questions that kept coming back is, how do you help women distinguish between enhancing their beauty and chasing unrealistic beauty standards?
That's a great question. So one of the most challenging things that I do is guide people through this process of enhancing themselves or improving their beauty. We have so much pressure out there regarding the standards of beauty, and they keep changing. And it's like they say this, they keep moving the goalpost. And my job is to educate women and men and actually explain to them what's going on and what is doable, what is not doable, and what will look good and not look good. That is a challenging thing because many people have an idea of what they want because of what they've seen on social media. So they're preconditioned as to what they expect. And realistically, I know some of these procedures and surgeries that they're having done are going to harm them. And one of the things that doctors do is we take an oath that above all, do no harm. And I take that very seriously in my consultations. And many times I end up saying, perhaps we're not the right fit, and I don't do surgery on someone if they have those types of expectations. But ultimately, I think that the role of the surgeon should be a guide that should help someone decide what is okay and safe to do and not make it too extreme or dangerous.
So that follows up with a question that I had, because there is a psychological component to helping somebody, guiding somebody to make the best choice for themselves, be it man, woman. And I see where you're going with that. What do you wish more women knew or asked themselves before considering, or men, or before considering a cosmetic procedure?
Well, I think they should be very educated. They shouldn't just go to one consultation. They should go to multiple consultations by, if it's going to be in plastic surgery, a board-certified plastic surgeon. If you're thinking about having a facelift, at least make sure it's a board-certified facial plastic surgeon. They're two different things, but make sure they're board-certified in that specialty. There are many people that say, well, we have board-certified doctors. And board certification means you're a specialist at something. So you could be a board-certified urologist. That doesn't make you the best guy to do their breast surgery. And that's something
I'm glad you're clearing that up.
Because I think that's really important. And many people, they say, oh, we have board certified. And board certification, there are actually 40 board specialties in the United States and the 89 subspecialties. So make sure that whoever's going to work on you is board certified in that specialty.
I'm glad you cleared that up. What is the most common procedure that people come and ask you for, especially women?
Well, to me, the most common one, it depends on the age bracket that we're looking at. So you have younger women, usually they want breast enhancement. It was very popular to be getting the BBL. I stopped doing BBLs a bit ago. I do some gluteal enhancement in the hip area, but I don't do the traditional BBL. I stopped doing that a while ago. I didn't find it very aesthetically pleasing. And so at different stages, after they've had kids in their 30s or 40s, they're coming in for mommy makeovers, tummy tucks and breasts. And then once you get into the late 40s and the 50s, now we're looking at facial rejuvenation. And that's become very popular. The facelift is coming back, I like to say, with a vengeance, because we've overfilled the face. So a lot of women are coming back and trying to look more natural. And the best way to achieve that is with a facelift.
So they're very interesting. So when a woman, let's go into women, are in their 40s and they start filling their faces with fillers, that comes back to haunt them.
Yes. So when we look at specialties and we look at many people have become cosmetic surgeons or injectors, and that's very popular in today's world. The way I see it, 90% of nurse practitioners want to come out and become injectors. Right. And there's only so many faces in the world and so many grams or cc's of volume of filler that you could possibly put into anyone. And what happens is we've talked about filler fatigue. Filler fatigue happens when you overstretch the face. And we've seen that. We've all seen that out there. And to me, having someone with ethics and guiding you into, like, okay, this is too much. But if that's the only way you make money, there's going to be tremendous pressure to say, come back in 6 months. We'll do a touch-up in 6 months. We'll do a touch-up in 6 months. Well, the fillers don't go away. And so what's happening is you're seeing these overfilled faces, weird-looking faces, and everyone starts to look the same. And the return to a more natural look involves actual performing elegant, sophisticated plastic surgery.
So how do you do that? How do you help women figure out what's right for them?
So you have to get a sense. Part of the number one, you have to spend time listening. And if you have a consultation with a surgeon that doesn't listen to you, that might not be your surgeon. But you should look at that as a red flag. Your surgeon should, like I said, should get to know you personally in the sense of what are your goals? What are you looking for? Why are you doing this? And he should be your guide. And there's an ethics to it. And that's a component that I believe is really missing a lot, that you're not just going for, a burger and you're checking out, I'm getting this done. You should really have someone take a look at you and say, are you doing this for the right reason? And ask you those questions and challenge you. And then you get an idea whether this person should be the one operating on you. So the first step is, does your surgeon listen? And do they care? And do they just say yes right away? I think, so education is the most important part. And that takes time. Another thing is finding someone that, perhaps a friend that had a good experience, that can help you guide you in that direction. But I think that educational part is crucial before someone decides to have cosmetic surgery.
So do you ever turn down somebody that is having excessive surgeries that they want to be in the office all the time?
I usually try to, let them down easily. But at some point you realize that you're never going to make this person happy. You're never going to achieve their goals. And it's not a good idea. So when there's something called the patient-doctor relationship. And that's a very important, that is one of the most important things that a doctor has with a patient. A patient's trusting you. Mm-hmm. They're coming to you with trust. Mm-hmm. And you have to take that trust seriously. And if you cannot meet those requirements, You have to ask yourself, am I doing the right thing to this person or not? And if you have the wrong idea, you should go into somewhere else.
But not all doctors.
No. And you see, and so for me, my patient experience is really important. And I need to be able to feel comfortable. It's a relationship. And once you operate on someone, it's not just like giving someone a ring. You're giving them a ring that they can't take off. So you have to make sure before you get into that relationship that it's the right one. And it is and has become a much more competitive market. Every doctor wants to get into the cosmetic world because it's a cash business. They're not dealing with insurance companies, they're dealing with cash. And it's very attractive. So many specialties, regardless, you have, of OBGYNs doing lips, you have dentists doing lips.
Yes.
You have Botox being done everywhere. Your hairdresser is doing Botox, whether it's legal, not legal. It's Miami. It's Miami, in Miami we live, I call this the Wild West of plastic surgery because there's so much competition and so many people want it. There's a huge demand. And so the supply has become increasingly heavy, and for plastic surgery is very competitive. And not everybody can charge a certain amount. Having a quality office, having quality staff, having quality equipment, quality anesthesiologists, these things cost money. And people don't realize that when they're going to get this, sometimes they'll be driven to get it done because it's cheaper somewhere else.
Mm-hmm.
Well, the cost of things, that doesn't change. So when someone's offering you a very, very low price, they're cutting corners somewhere. And you have to be very, very careful that that might not be the right place to have surgery. And I understand that there's a lot of pressure because they have a budget and they want to get, say, a mommy makeover. They want to get their breasts. They want to get their tummy tuck. They want to get lipo. And they have an idea of what they want and they don't have enough money. So that's when they end up being prey to these places because they want to get it all done and all at once, and it's cheap and it's dangerous and people pay with their lives.
And distorted.
And botched.
I've even heard that some dentists are doing bluffs for the eyes. That's dangerous and sad.
It's not to say that anybody couldn't do it in the sense of the technical aspect. At the end of the day, you're removing skin and you're doing, but having the most important thing when you do any procedure is knowing what to do with a complication. Is what happens when this doesn't go right. And the way you're doing the operation is thinking what can go wrong. So if you just learn a technique and you just go out there and start doing it and you don't know how to manage the outcomes, you shouldn't be doing it.
So the person that goes into surgery has to go very confident on the doctor and everything that surrounds.
The staff, the equipment, the ambiance of the office. It is a team-oriented experience.
Just tell me real quick the difference between, I needed to know plastic surgery and cosmetic surgery. You were saying plastic surgery was?
So in plastic surgery, right now, when I started, we would do 5 years of general surgery and either 2 years or 3 years of plastic surgery. Then we started having combined programs where it could all happen, where you did 3 years of general surgery and 3 years of plastic surgery. And that's a board-certified plastic surgeon. So we learn how to operate. Doing 3 years of general surgery, you learn how to operate in the intestines. You're operating everywhere in the body. And then you subspecialize in plastics, where you get to do reconstructive surgery of all types, all parts of the body. We also do hand surgery. So we share the training of hand surgery with orthopedic surgery. And plastic surgeons, we also share the face with ear, nose, and throat and maxillofacial surgery. So we're truly trained to operate anywhere in the body as board-certified plastic surgeons. A facial plastic surgeon trains in ear, nose, and throat, and then there's an extra year just to operate on the face. Now, these guys are very well trained in the head and neck. That's what they specialize in. And then some of the best facelift guys in in the world right now are facial plastics guys, but they can't do your breast. They can't do your tummy. They can't. So, but at the same time, they've done an excellent job bringing the facelift to new levels. And now a cosmetic surgeon, that's just some, not even, I don't even think it's a real board specialty. It's a certificate that any doctor can get for doing some online courses, some load training, and maybe some shadowing of someone. And they get a certificate saying that they're a cosmetic surgeon. And it doesn't, you really have to scrutinize. There are some cosmetic surgeons that have had good training, that they were general surgeons, and they've worked with plastic surgeons, for instance, and they could be good surgeons. But again, buyer beware. You need to do your research and find out who's going to do that.
Research is key.
Yeah.
Research is key. How can women embrace aging? Because again, it goes into, and men. And when I say women and men, but
Well, that goes back to my concept. After doing this for so many years, I realized that it's not a unidimensional specialty. It should be, and that's the way I treat it. I treat it a more of a holistic experience. So there's my triad that I talk about, the wellness balance triad of the physical, the physiological, and the psychological. And those three components go together like a tripod. So if you take a tripod and you take away one of the legs, it falls. So when women get older, they're experiencing significant changes, and they're not just physical. So as they start hitting the menopausal years, it's devastating what happens psychologically and physically. And they both, and physiologically, because the way their hormones are playing out and what they're experiencing looking in the mirror, it's a very dangerous stage in a woman's life, because then they don't know what's going on. And if someone doesn't truly explain what's going on to them, they feel prey. Excuse me, they fall prey to people that are going to say, oh, do this, you're going to feel better. Do that, you're going to feel better. But again, they must be educated and guided through this process. If you can help a woman understand what's going on, she perhaps can accept some things, and the things that she doesn't accept, like hormone replacement therapy, some women can get it, some women can't. And that's really important. If you can and you're able to do it, bioidentical hormones are a great way to address that physiological situation that would ultimately resonate psychologically. When a woman has her hormones back, she feels so much better. And you know that.
I can test to that.
And then you work on some of the physical changes that happen. So I believe in this holistic approach that you really truly get to know your patient and make sure that you're doing the right thing at the right stage. Now, do you accept it? No. I don't believe, you should accept anything that you don't like. If you want to go down swinging, but do it in a sophisticated, elegant way.
of course.
And that's the whole thing.
Yes, it's the confidence and how you move yourself into different phases in life, the different stages in life. And if you have a good doctor, good surgeon that guides you well, then it's a win-win. Real quick question. Kris Jenner. This is a big thing that's going on, the big phenomenon.
Okay, there are lots. The Kris Jenner phenomenon is fantastic because again, we've reached new heights. The new techniques, the deep plane facelift, even though she technically, and we would have to have a whole other discussion on the techniques for faces, where I would have to do some show and tell perhaps. But the bottom line is we're getting to a new level of surgery, but I also have to explain that there are other factors involved. There's also tremendous weight loss going on. So when you look at people, when they lose weight, they look better. And if you lose weight and you do some surgery, you're going to look better than if you didn't. And the last component of that picture is AI filters. And what you see on social media isn't necessarily real. So What I've noticed is a tremendous amount of weight fluctuation, probably a dissolving of fillers that she had along her jawline, and then the repositioning of the tissues in a natural way. And then you're seeing what a lean feminine face looks like. I think we're getting away. The full face is a more masculine face. Why everyone is so in love with her look is because all of a sudden she has this petite, feminine looking face. And that's what people are realizing. And we lost that for probably at least 10 years with women overfilling their jawlines, especially.
Go with the fillers, yeah.
Everyone was trying to go for the Angelina Jolie jawline. Everybody wanted filler in their jawline. And that's a masculine look. A full jawline is not feminine. And so to me, that combination of getting rid of fillers, weight loss, and elegant surgery, man, you get a good result.
No, she looks fabulous. But, you know, everybody's questioning as to
No, it's the hottest thing. It's
what's went on.
There's so much different.
and every surgeon's out there. Some people are saying like ponytail lift, and they're kind of promoting their own.
Right.
The ponytail.
Everyone is promoting what they do, but the reality is that if you do a good facelift, whether it's a smash facelift or a deep plane, and you're using the right layers and you're pulling in the right direction, what you need is the right surgeon. The technique itself is not so much what's going to do it. If you have an artist, a good artist, you could give that artist a spoon and he's going to carve something beautiful. But if you're not a good artist, I don't care what technique you're going to use, you're not going to have a good outcome.
So the cosmetic surgeon has to be an artist.
Definitely, we agree.
Feel that.
And you have to be able to see your product. You have to understand and explain how good of an outcome you can get on everyone. And you're not going to be able to do that on everyone. So the rule is the prettier you were, you can go back to that. But when people try to change their appearance, that's when I think we get into a very weird place. When everybody's trying to look the same, that's a problem. That's a problem.
Thank you, Enid, for those wonderful questions. I have one last question for you. Being a patient in your practice, both of us, and you touched on bioidentical hormone replacement. What other services does your practice offer to ladies out there listening to our podcast?
So one of the things that I started doing, because I do believe in this holistic approach, so I started my wellness branch, Results MD, and it's taking off right now. It's a name that I've always loved because I'm all about results. And so Results MD is going to encompass the entire wellness triad. What we talked about, the balance of the 3 Ps that I call it, the physical, the physiological, and the psychological. And it's really trying to put all that together in one place. And the services we'll be offering will be everything from weight loss to hormone replacement therapy,
Wonderful.
lasers, Botox, not a lot of fillers. I mean, I do think fillers have their place, but I definitely don't like to have them overdone. And so that side of the practice is grown, and it'll be interesting to see how it evolves when you have this sort of all-in-one. And my job is to be the guide through that journey, which I think is very important, and it's a privilege to do that.
Thank you very much. Thank you very much for
Pleasure.
having us here today. It's been a pleasure interviewing you. And we look forward to more podcasts.
Absolutely.
Thank you so much.
Lots of good topics out there too.
Yes, there's a lot of things to discuss. Thank you, Dr. Soler.
Thank you, doctor.
Thank you.